The pathophysiology of hand contracture disorders involves various underlying mechanisms depending on the specific condition. However, the general process typically includes tissue fibrosis, inflammation, ischemia, or nerve damage, which lead to stiffness, reduced elasticity, and impaired function of the hand. Below is an overview of the pathophysiology for common hand contracture disorders. 1. Dupuytren's contracture. Pathophysiology begins with an abnormal proliferation of fibroblasts in the palmar fascia. Excessive production of type 3 collagen leads to fibrous nodules and cords. The progressive fibrosis causes shortening and thickening of the palmar fascia, pulling the fingers into flexion. Key mediators, transforming growth factor beta, TGF-β, plays a critical role in fibroblast activation and collagen deposition. Result: permanent flexion contractures, typically affecting the ring and little fingers. 2. Trigger finger, stenosing tenosynovitis. Pathophysiology. Inflammation of the tendon sheath, fibrous structure surrounding the flexor tendon, leads to thickening and narrowing of the sheath. The flexor tendon cannot glide smoothly, causing it to catch or lock during movement. Prolonged inflammation leads to fibrosis and nodule formation on the tendon. Result: difficulties straightening the affected finger, often accompanied by pain or clicking. 3. Claw hand, ulnar nerve palsy. Pathophysiology. Damage to the ulnar nerve causes paralysis of intrinsic hand muscles, lumbricals and interossei, responsible for flexion at the metacarpophalangeal and CP joints and extension at the interphalangeal IP joints. Unopposed action of extensor digitorum and flexor digitorum profundus results in claw-like deformity. Result: hyperextension at MCP joints and flexion at IP joints, particularly of the fourth and fifth fingers. 4. Burn contractures. Pathophysiology. Deep burns lead to the destruction of skin, subcutaneous tissue, and sometimes underlying muscles. During the healing process, excessive scar tissue, fibrosis, forms, pulling the surrounding tissues inward and reducing elasticity. Contractures form due to the imbalance between scar tissue contraction and normal skin tension. Result: restricted hand and finger movement, skin tightness, and deformity. 5. Volkmann's ischemic contracture. Pathophysiology. Results from prolonged ischemia in the forearm muscles, often caused by compartment syndrome or arterial injury. Ischemia triggers necrosis of muscle and soft tissues, followed by fibroblast activation and scar formation. Muscle fibrosis and contracture develop as the dead tissue is replaced with non-functional fibrotic tissue. Result: permanent flexion contractures of the wrist and fingers, along with significant loss of hand function. 6. Rheumatoid arthritis-related contractures. Pathophysiology. Chronic autoimmune inflammation leads to synovitis, inflammation of the synovial membrane, and joint destruction. Tendons and ligaments become stretched or eroded, causing instability and deformities such as swan neck or boutonniere deformities. Fibrosis of joint capsules and surrounding tissues contributes to contractures. Result: joint stiffness, deformities, and impaired hand mobility. Common pathological mechanisms. Fibrosis, excessive deposition of collagen and connective tissue leading to stiffness and reduced elasticity. Inflammation, persistent inflammation causes tissue swelling, pain, and eventual fibrosis. Ischemia, reduced blood supply leads to tissue necrosis and subsequent scarring or fibrosis. Neuromuscular imbalance, nerve damage disrupts the balance between flexor and extensor muscle forces. Mechanical factors, repeated stress or trauma contributes to structural changes and contracture formation. Summary of effects: loss of range of motion, stiffness, and inability to fully extend or flex the fingers. Pain, due to inflammation, nerve compression, or tension in fibrotic tissues. Functional impairment, difficulty performing tasks requiring grip or fine motor skills. Understanding the specific pathophysiological processes is crucial for tailoring treatment, whether through physical therapy, medication, or surgical intervention.